This week, smartwatches, wearable devices, and telemedicine. With the election out of the way, I have been left with tech alone. We are at the HealthX headquarters in Nairobi. Here, they use the power of digital technology to reach patients wherever they are, whenever they want, and as often as they need.
Hi, Dr. Yvonne. Fine, thank you.
Yes, after the pandemic, anything that reduces contact is welcome, and healthcare is moving virtual, whether you like it or not. Well, this is just one platform. In Kenya, there is a couple, but in a not too distant future, healthcare services could go entirely virtual. Well, that's if it's not something serious, like an operation. But what an exciting day for me, my debut. And what I'd like you to learn today, if there's one thing, is that you can access healthcare services using your phone, and it doesn't have to be smart. That in a moment, but first, here's your tech news. Tech has some sense of repetition in new advances. You can tell from the only difference being battery capacity and camera quality in new mobile devices. But tech companies are focusing on improving health data collection, and now healthcare is in the midst of a digital revolution. This app, for example, it is designed to keep records of your heart rate, weight, sleep quality, step count, and more, just by using a watch connected to your smartphone. But just how can wearable technology be applied to healthcare?
In the telehealth or telemedicine practice, that's how, when we started, I told you we have a lot of technologies that we use. The phone, the video call, the chats is one of them. Wearable devices, or devices, let me call them remote devices, is another one that we use. So what we have, I'll mention as HealthX and then the telehealth space in general. What we call them telemonitoring devices, where we can monitor certain aspects of your health remotely. For example, we have a weighing scale that you can use it. They're usually Bluetooth enabled, so they're connected to your device, either your phone or something. And once you use them, it transmits the data to the phone, which then transmits to us here. And we can see it in real time. If there's something abnormal, it flags. So you have a blood pressure machine like what we have here. It's also a remote. It's something that you can use remotely. We have a temperature machine. We have a blood glucose, for measuring sugar for patients with diabetes, or if you're trying to screen for diabetes. Sends it straight here, and that sort of makes it feel like you have a doctor with you 24 hours, because we see these things immediately. Other devices that are there are things like watches, wristwatches, which can tell your pulse, some of them can tell your oxygen saturation, how much oxygen you're absorbing in from the air. It's actually a very important measure when it comes to COVID. People use them also for working out, because there are certain parameters, certain measures you're looking for when you're working out. But one of the challenges with these devices is that you have to make sure that they are standardized. In that, for example, if your watch, you have a wrist device that can measure your wrist blood pressure. If it says your blood pressure is, let's say, 120/70, how sure are we that that is actually your blood pressure? So the device has to be standardized. But there are bodies that do that. There are quality bodies that actually make sure that the devices are standardized. Some of these devices actually have been shown to have more accurate measurements than the standard devices that we have. For example, blood pressure. Blood pressure is a measurement that changes. If you're running versus if you're seated, it changes. But if you have the device that's continuously measuring your blood pressure, like over 24 hours, that measurement will be more accurate. Blood sugar, the same thing. There are devices that can be attached to your body that measure your blood sugar at certain intervals, so it gives a better reflection, because now the technology, because you can't be at the hospital the whole time doing measurements, the technology helps us know how you're doing even outside the hospital setting.
We're living in a world where people are educated about their health, and most people have gadgets, so to say. So I'll not need to have you come to a facility for me to know your blood pressure. These are gadgets that people normally have nowadays. Blood glucose monitoring devices, they're also available to our patients. So these are things that people have made it easier on us, so that once you come to me with certain symptoms, I'm able to ask you, did you have your vitals checked? We also have people who have thermometers, so this is making us, it is giving us an easy time and quick access to these services.
Well, if you felt sick 10 years ago, you'd have to physically go to the hospital or see a doctor somehow. And it feels harder when you're actually sick. But with the pandemic came lockdown, and now technology has disrupted the health sector and inspired the minds of new innovators. In come telemedicine. My name is Kelley Boss. This is Techfile.
Basically, telemedicine can be defined in quite a number of ways, but what it basically means is that we are using technology. We are using a number of technological advancements to make it easier for people to access quality healthcare services. So in a nutshell, we are bringing healthcare services closer to the consumer using technology. So this could be either through a video call with a doctor or a nurse or a specialist. It could also be through a simple voice call with a doctor or a nurse. So anything that involves the use of technology to access a healthcare practitioner can be grouped up or summed up as telehealth or telemedicine services.
Over the past decade, telehealth has been growing steadily. According to the Telemedicine Service Market Global Report, the global telemedicine market is expected to grow from $39.3 billion in 2019 to $78.3 billion in 2023. But just how would a typical virtual health experience be like?
A typical multi-pocket doctor experience for a patient is just like any other hospital. Our patient journey goes in hand with what a patient will experience just walking into a hospital. So our first response, or the first response to a patient, is a nurse. So our platform has nurses and doctors. So once a patient comes in, the nurse will be the first reception. So we do triage of the patient, and we also want to ensure that the turnaround time for the patient is at least 30 minutes. So once we do the triage, then the nurse will also liaise with the doctor, so that the doctor can also do the consultation. So majorly for the nurses, we prioritize on the needs of the patient. So depending on what the patient comes in with, that is what will make me prioritize on who will be seen first, second, depending on their needs.
That was happened before me.
While addressing Kenya Kwanza's Economic Health Forum in June, President William Ruto promised that his government will procure a digital health record system for portability of patients' data and telemedicine.
A health management system, an electronic, so to speak, health records system so that we avoid the duplication that is going on. You go to a facility, go to MRI. You go to the next facility, go to MRI. You go to a hospital here, go and take these samples. We can reduce significantly the cost of deploying our health by making sure that health records are available. We just need a mechanism, and it is not rocket science because it's done by other countries, of making sure that there is health records confidentiality. Outside that, there is absolutely no reason why we must not have electronic health records that are portable, that when you go to a health facility in Korogosho, and tomorrow you go, or next week or next month, you feel sick and you go to a health facility in Nakuru, the doctor or the health professional in Nakuru should know what you are diagnosed with, the kind of treatment you were given, and then begin from there to figure out what can happen next. That way, we can bring down the cost of delivery of our health programs.
Hi, Dr. Yvonne. Fine, thank you. Yeah, just demonstrating this to our guys here. All right. Okay, thank you very much.
You're very welcome.
Okay. Telehealth is basically just the practice of medicine, but now leveraging or using technology to deliver the healthcare. So technology is basically just a tool that we use to deliver the healthcare, and also helps us surmount certain challenges when it comes to delivering healthcare. Yeah, challenges like distance, challenges like cost, which is what we use. And by technology, mostly is technology to do with communication, telephony, video calls, chat devices. But there are also other forms of technology that we use in terms of medical equipment that can be used across distances. The main tool that we use is number one, we have a toll-free number, which means you can actually call using it, and all you need is just a phone that has a network connection. You don't need a smartphone, you don't need any airtime, you just call in, and that's how 70% of our clients actually access us. The other major method that we use for clients to access us is an app. We have a healthcare app which you have on your phone. It's either Android or iPhone, and with this app you can reach us via call, you can reach us via video, you can also chat us. You can even chat us through the website directly. That's how our clients reach us. Another one that we have that is still being implemented is something called the virtual clinic or virtual clinic system, where we have a device like the one that's just on my right, where we can set up a clinic somewhere, which could be remote, could be in Mandera, could be in Mombasa, and the patient can reach us in Nairobi. With this, we can take measurements of the patient, things like blood pressure, temperature, even listen to the patient's chest virtually, and through this device they can access us from wherever the virtual clinic has been set up. Our costs, first of all, are very low. You find that the monthly subscription cost starts from about 495 shillings, which is under $5 in a month. A single consultation with a doctor costs about $15. So as for a whole month, you can access for under $5, which drastically cuts the cost. So other costs that are cut that are not really visible is the cost to the patient. How long does it take you to get to the clinic? Transport costs to actually come to physically see a doctor as opposed to calling the doctor from home. Costs in terms of a patient needing time away from work so that they can access us. You find that probably it takes about 2 to 3 hours to see a patient in a major town. To see a doctor as a patient in a major town takes a lot longer if you're in a rural area or if you're in a remote area. So all that is cut short because all you have to do is just call up, chat, or video call the doctor, and immediately you have access to the doctor.
In the early days, telemedicine was of great benefit to rural or hard-to-reach population. And for a long time, the equipment necessary to conduct remote visits remained expensive and complex. But the rise of tech and internet age brought with it profound changes for the practice of telemedicine. Now, it is seen as a cheaper option for tech-savvy millennials and busy people. In fact, a number of research studies have found it to be effective and satisfying for both patient and providers. Telemedicine has been used as a tool to protect medical practitioners from exposure to COVID-19 and keep the vulnerable and healthy at home. Companies like HealthX and My Pocket Doctor have seen a big boost in users during the coronavirus pandemic.
Digital healthcare in general, not just telemedicine, was sort of catapulted to another level. So we across the globe, it started blooming, and people were more aware of this service because you could be seated in the house during lockdown and people were wondering, what do I do? I'm experiencing symptoms of a certain condition. You cannot even access a pharmacy near you. So at that time then, most of the digital healthcare platforms took advantage. There was a lot of marketing for such kind of platforms. We had so many of such companies launching in Kenya and across Africa and many other parts of the world. So we could say that COVID-19 was a very big booster for this particular industry.
It is increasing, and people, although there still is some skepticism, but once people use these services and get satisfied and have good outcomes, then you find that they start using the services more often and more repeatedly. So it's slowly growing. COVID jump-started it to a certain level, so it's slowly growing and people are adapting it.
Kenya Medical Practitioners and Dentists Council is now taking up telemedicine as a way of increasing access to healthcare and promote universal health coverage. The council is now issuing annual licenses to health facilities to offer virtual health services. This move has paved the way for private entities, and now they are positively disrupting the health sector.
When I have a phone, when I have internet, I'm able to provide these services to you. Same case to you, you only need to have a phone. And all I need is to give you a call. That is it. And the best thing about having teleconsultations is that I'm able to give you an e-prescription. That is what you normally give in My Pocket Doctor. You give an e-prescription. So it's something that you have this prescription in your email. So all you need to do is go to a pharmacy and get your medication.
Currently, we have about 13,000 doctors for a population of about 50 million people in Kenya. But the recommended ratio by WHO is about 1 to 1,000. So we're currently doing about 1 to over 10,000 doctor-patient ratio. But then again, remember about almost 80% of the doctors are in major towns. The rural areas, remote areas, where more than half of the population resides, are only served by about 20%. So how this helps is that rural areas, remote areas get increased coverage because you can get to them using these telemedicine services. You don't have to be there physically. A doctor in Nairobi, where most doctors in Kenya are actually based, can attend a patient anywhere. So this helps increase the utilization of the doctors we have. Currently, we also have a situation where despite the deficit, not all doctors are employed, despite the deficit. So telemedicine services actually do give doctors a platform to be further utilized. And we also have doctors who are underutilized, not working the maximum hours they can actually work. So it does help at least increase the utilization. And this does help, helping in the distribution of doctors, because remember, most of them are in urban areas. And at least 2, more population is covered. But at the end of the day, the best solution will be to produce more doctors, and not in a rush way, in a quality way. We don't just jump from being a doctor to using a phone. There are policies, principles, standard operating procedures and protocols on how you manage a patient with a telemedicine platform. We're very high on patient safety, such that if a patient needs to be seen physically by a doctor, we're very quick to refer. But so far in Kenya, we've managed to, we manage about 90% of the patients in-house, meaning that patient does not need a referral. So far we've managed to sort out 90% of the patients who call, we sort them out without a referral. We operate 24 hours, meaning you can access us anytime. Unlike most day doctors, outside emergency cases, you probably just have 8 to 5 to access them. Now here it's 24 hours, so you can access the doctor at any time, and the doctor is capable of attending patients, not just in Nairobi, but in Mombasa, in Kisumu, in Garsen, any place within our borders where you have mobile network coverage, the doctor can actually see you.
The coronavirus pandemic provided a clear line between the before and after for the healthcare industry. Now, telemedicine might be a big part of what comes after.
There's a lot that will happen with digital healthcare moving forward, and this is because we are having talks even of use of artificial intelligence from across various fronts. We have so many projects and programs that are going to be rolled out even from our own My Pocket Doctor. So we feel that there's still a lot to be achieved because the acceptance has actually increased.
Well, it feels good to know that you can access healthcare services without having to go to a hospital. And even better, that the growing overlap between technology and health could actually increase healthcare access and quality in Kenya. My name is Kelley Boss. This has been Techfile. And now I'm just under 2K steps to hit my daily target, so I'll get to stepping.